Yeah. Do you see the countdown on your side when it's going?
I do.
Yeah. Okay. This is episode number 2 of our podcast here and YouTube. So we're doing a little kind of, I guess, mini series on hormones and menopause.
Yes.
And one of the first things we're going to talk about here, real quick, disclaimer. I think it's ridiculous we have to do a disclaimer on every single video, but just because you're listening to our podcast does not mean that we are giving you medical advice. This is educational purposes only. And it does not mean you are a patient, blah, 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 disclaimer, all that stuff.
Sounds good to me.
Yes. So, and I'm sure I'll put something in there at the end in writing as well. So the first thing here is we're basically just going to talk about what is menopause, right? Because there's premenopause, perimenopause, postmenopausal, all that stuff. And many people don't really know what it is. So, Nurse Jessica, what is menopause?
Yeah, I really want to start off with some fun facts because it is very unknown. And it's sad because a lot of us, I mean, for one, I am a certified nurse midwife and a nurse practitioner in the state of California, and I did not get a lot of education. And you talk to some of these OBGYNs as well, and they will tell you the same thing. Menopause is not well taught, and it is a lot of because of there's not much funding for research. So we like to talk about reproductive years and all the pregnancies and things like that, and that's where all the money goes for research. So unfortunately, for the women that do go through this, half their life are just unstudied, which is a shame. So some fun facts, like we are born with all of our eggs. So about 1 to 2 million eggs that we're born with, and men tend to continuously make it every single day for their life. So by the age of 30, as women
you hear about the 80-year-old dads, right?
Yes, and we don't get that opportunity.
No.
So you can kind of see how we're at a really big disadvantage here because you can continue to make this while we halfway through our lives completely just shut down that once upon a time thing, right? So like by the age of 30, we are down to 10% of our eggs.
Yeah, and when you say this, just so that we're clear, we are talking sperm.
Correct.
Yes.
What you make, yes. You are a man.
Yes.
I'm talking
just to be clear, because some people are going to be like, what is she talking about?
Yes, no. Yeah. Yes, I am talking about a man and making sperm.
Yes, it's okay.
And as females, we are born with a preset amount of eggs, and that's all we have. We don't get the opportunity to make more or have more. So by the age of 30, like I said, down to 10%, and by the age of 40, down to 3%. And there's a huge stigma around menopause, and it's sad because every single woman will go through this at some point in their life. So we need to do more of, number one, talking to our moms. It's genetic. So we tend to go through it around the same age that our moms did. So find out when they went through it if we can. Talk to others and make the subject just more of a normal subject. And that way we can get, more information about it.
It's always interesting when we talk to patients and they're coming in for perimenopause symptoms or postmenopausal, and you ask them, well, how old was your mom when she went through menopause? And they have no idea.
It's not talked about.
No, I would probably say, I don't know, 75, 80% of women don't know when their moms went through menopause.
Oh, I'm going to go higher. I'm definitely going to go with 85 to 90. I mean, it is so rare. And if somebody's mom did go through something, it's a hysterectomy. And they definitely know that information, right? They're like, oh yeah, my mom had a hysterectomy. Well, you don't know when she went through menopause then.
No, right.
Yeah.
She went through a spontaneous menopause.
Exactly. And they're like, that's what it was. I was like, no, nice try. So that's how we can tell this is just so unknown. So let's start off with some super, super basic terminology. And let's just start off with premenopause, because I know that sounds very, very close to perimenopause, but premenopause is our reproductive period. So when you menstruate, it literally is the time you go through puberty to menopause. Okay, so that's premenopause.
Right.
Perimenopause is a very, very critical stage before menopause. This is a time of chaos, and I say complete chaos because honestly, if you ever seen one of those scales that detects earthquakes, that's what our hormones look like. Sure. It's complete chaos.
And that's where a lot of the symptoms come from as well.
Yes, it can start. I think the statistics say, honestly, about 15% may not get symptoms. 15%. That's crazy. But this is definitely like where your cycles start getting wonky or irregular. And literally they could be early or late or heavier or lighter or shorter or longer, right?
Right.
Eventually you will start skipping a stage or two. And that's when we really can indicate that perimenopause. So that can last anywhere from about 7 to 10 years. So that's a long time.
It was a long time. Now, how long does it typically last?
Um, it really varies. I definitely tend to understand a little bit more when we back it up. So hindsight, right? So when women are kind
Sure.
of talking to me and they're like, "Oh, wait, so yeah, actually my cycle started getting heavier at this point, and this is when I started missing periods." Because a lot of the times people think, "Oh, perimenopause is just when I start missing them."
Right.
So hindsight, it tends to be a little bit longer than what they typically think.
Right. Because most people, I would say, they think a year, maybe two is kind of
Yeah.
that range.
Yeah.
So, yeah. Okay. Then, so what is after that?
Yeah, so then we hit menopause, and literally, menopause is one day of a woman's life, okay? One day. And obviously, we have to, by definition, only be able to diagnose you for menopause after 12 months of your last menstrual cycle. So,
Right.
12 months after your last time you have a period, that is menopause. It is one day. So, your last
Just the
cycle,
textbook definition of menopause.
correct.
Kind of like your birthday, right? You only get one
Yeah,
actual birthday.
exactly. That is it. It is one day. Menopause, one day. You
Yeah.
literally have no more eggs. That's it. You're done. And
Yeah.
usually the average age in the United States is 51, but it can start anywhere from 45 to 55.
Well, is it actually that you have no more eggs, or you're just not releasing more eggs?
Menopause is no more eggs.
Yeah, but okay, so how many eggs are we born with?
Like 1 to 2 million.
Okay, so we don't release all 1 to 2 million at up to that point, right?
Correct. Because each cycle you can develop so many within your follicle, right? And then only one, yay, is the winner, winner, chicken dinner, and it comes out and
Right,
you ovulate. Hmm?
right. But so we haven't released 1 to 2 million over up until menopause.
Correct.
Yeah.
Correct. You
Okay,
only ovulate one time a month if you're very lucky.
if you're lucky. So
Yeah.
then postmenopausal is after that single day.
Correct. So that's the stage starting 12 months after that final menstrual cycle. Some symptoms may start to disappear or get a little better, but that is definitely not always the case.
Okay, and then you talk a little bit about different types of menopause as well.
Yeah. And that's something that like we just kind of touched on. One of them is an induced or surgical menopause when menstruation ends due to like removing your ovaries. Um, and that can be for a number of cases, but induced menopause can happen over months. If we're talking about a surgical outcome of removing your ovaries, then it hits somebody very quickly. And let's just use cancer for an example, right? And you want to take out your ovaries.
Right.
Menopause is brought on somebody drastically. So that's what induced or surgical. Now, this does not include a hysterectomy because you are not usually taking out your ovaries. You are just taking out your uterus.
Right, which would be like a
Um,
partial hysterectomy versus full
correct.
hysterectomy. Yeah.
Correct.
And a lot of
Correct.
women think that if just because they're not having a cycle because they've had their uterus removed, that they're in
Yes.
menopause also, which
Yes,
is
I get that a
not
lot
true.
too.
Yeah.
Correct, because your ovaries are still going to work. You just don't have the opportunity to bleed anymore.
Correct. Yes.
Yeah.
Okay. So then what causes a lot of the symptoms with perimenopause and menopause? And
Yeah.
what are some
So,
of the symptoms? Which we'll kind of
yeah.
get a little bit more on our next one as well. But
Oh, yeah. There's a list of them. I don't know if we can go over all of them. But basically, when starting into perimenopause, we start by losing progesterone, which is the hormone you make right after you ovulate, which ends up being another challenge for our body and what we're going through. Our follicles are just not as active or responsive as they used to be as well. We are slowly running out of our eggs and our FSH and LH, which obviously are those hormones that make us ovulate. They increase drastically to try to help us to ovulate. Now, at this time, you have really, really high fluctuating estrogen, up and down, up and down. That's why I talked about like that little earthquake looking scale.
Yeah.
And then by menopause, your progesterone and estrogen both kind of bottom out, and your FSH and LH just stay elevated. And go ahead.
No, go ahead.
I was just going to say, and what a lot of women really don't know is every organ system is affected because we have an estrogen receptor on every organ.
Right. And this is where a lot of times HRT or hormone replacement therapy starts to come into question as well, which we'll talk about on our next podcast here.
Yes.
Okay, so kind of a short and sweet. Do you have anything else to add to this for now?
Just that symptoms aren't always going to be hot flashes. And a lot of women think, well, great, I didn't have hot flashes, so I didn't go through menopause. Well, no,
Right.
It could be, your aches and pains that you really didn't understand, or you can't sleep all of a sudden. So, really be diligent at listening to your body and understanding what you're feeling and what you're going through and what's new, and always bringing it up because it can be part of the stage in our lives that we so easily miss.
Right. And we get a lot of patients that are either going through perimenopause, right? A lot of those symptoms, or even premenopausal, right? So they're not having those symptoms yet. And a lot of our times our goal is we're not looking to prevent menopause, right?
Right.
What you want is you want a nice smooth transition.
Correct.
Because it is a natural part of your health and kind of progression of things. So you want to go through it, right? But you want to go through it nicely as well.
Correct.
Okay. I think that does it for now on kind of what is menopause, perimenopause, postmenopausal, all that stuff. Join us for our next podcast, which will be coming out very soon after this one, because this was a nice and short one. The other one will be a little bit more in depth on hormone replacement, kind of pros and cons, who needs it, who doesn't, all that kind of fun stuff. And I'm trying to make it too long.
Try.
That's it for now. I'm Dr. Craig Mortensen. Nurse Jessica. Peace out.
See ya.